I think of all the fields, hernia has the most diversity in practice, outcomes. Can you explain to the audience what Global Rounds is going to be and kind of the point behind it, why we're trying to create this?
Absolutely. So along with Luca Giordini, who is a tremendous surgeon out in the area of Italy, we're going to really create a global effort to bring hernia education to the masses. If you look, it's kind of interesting because if you look at hernia repair from one state to another state, one country to another country, for the most part, there is some consistencies, but there's also a lot of variability there. The world of hernia is really, honestly, at a very young stage, meaning that we have a lot to learn. Hernia, as we know, if you look at the real data, 5-year data or more, the recurrence rate is over 20% in some cases. Not the best, right? We have a lot of work to do. So what we want to do with the Global Rounds is we want to make the world a little bit smaller. We really want to bring everyone together from across the globe, learn what everyone is doing basically at the same point in time, and hopefully take the best techniques from one part of the globe, put it together with another part of the globe, and really create a nice consistency across the board where everyone agrees upon what's the best way to treat these patients. Because right now there's a little bit of a disconnect, and we want to connect the dots. And that's what we're looking to do with the Global Rounds.
And I would agree with you. I think of all the fields, hernia has the most diversity in practice, outcomes. Well, not necessarily outcomes as much as methods, techniques, instrumentation. I mean, it's all over the place. And I was like, everybody in this room has read the studies, and yet we can't agree on how to repair any of these. How is it that we have there's no formal game plan? I mean, we tried to create them, but there really isn't any algorithm that exists that everybody's even trying to follow.
The issue is we really got to bring everyone together and really study the problems and honestly agree upon different methodologies for very specific situations. And that way, what happens is we get to standardize the process, we get to study it, and eventually we can really answer these difficult questions that right now we can't answer them confidently. But for the most part, if we can give the world guidelines on how to properly repair the majority of the hernias, then I think we're going to be in a much better place than we are right now.